Hello everyone, and welcome back to the channel. It's so good to have you with me today. I want to talk about something that I know affects so many of you, something that can truly impact your quality of life, your ability to play with your grandchildren, to take a walk in the park, or even just move around your own home comfortably. I'm talking about knee pain. Today, we're sharing easy and effective ways for seniors to fight knee pain. And I want you to know that you are not alone in this journey. We're going to walk through this together, step by step. The truth is, as we get older, our bodies change, and our joints, especially our knees, bear a lot of the brunt of a life well lived. But that doesn't mean you have to accept pain as your new normal. The key, and this is so important, is to focus on methods that are safe, gentle, and designed specifically for the needs of older adults. We're not talking about intense, high-impact workouts or risky procedures. We're talking about simple, powerful changes you can make in your daily life to find real, lasting relief. My goal for you, my mission, is to empower you with the knowledge to take back control of your health. I want you to feel strong, mobile, and vibrant. In this video, I'm going to give you my top 5 strategies for managing knee pain, a blueprint for a more active and comfortable life. These are tips that I've shared with thousands of people, and they truly work. So, get comfortable, and let's begin this journey to healthier knees together. The very first thing we need to address is strengthening the support system around your knees. Think of the muscles in your legs, your quadriceps, your hamstrings, as the natural braces for your knee joint. When these muscles are strong, they absorb the shock and pressure that would otherwise go directly to the knee, protecting the cartilage and reducing pain. But the key here is to build that strength without causing more strain. That's why we must start with low-impact exercises that are both safe and incredibly effective. It's not about pushing through pain. It's about moving with purpose and intelligence. I want you to begin with something you can do right now while you're watching this video. Sit tall in a sturdy chair with your feet flat on the floor. Now, slowly and with control, extend one leg straight out in front of you. Hold it for a count of 3, feeling the muscle at the front of your thigh engage. Then, just as slowly, lower it back down. That's a seated leg raise. Try doing 10 of these on each leg. Another wonderful option is gentle walking, either outdoors on a soft surface like grass or on a treadmill at a slow, comfortable pace. Even 5 to 10 minutes a day can make a world of difference. Remember, consistency is far more important than intensity. Don't feel like you need to become a marathon runner overnight. The goal is to create a daily habit of gentle movement. This simple act sends a signal to your body to build and repair. It lubricates the joint, improves blood flow, and strengthens those crucial support muscles. Start with what feels manageable, perhaps just a few minutes a day, and gradually increase the duration as you feel stronger. This is your personal journey, and every small step forward is a victory for your health. Now, let's talk about a classic, time-tested remedy that provides immediate, tangible relief. This is something you can do at home, anytime you feel that familiar ache or stiffness setting in. I'm talking about the simple yet profound power of hot and cold therapy. This technique is all about managing 2 key things: inflammation and blood flow. When your knee is swollen, stiff, and painful, it's often a sign of inflammation. By strategically using heat and cold, you can directly address these symptoms and give your body a helping hand in the healing process. Here's how I want you to approach it. When you're experiencing sharp pain and swelling, that's when you reach for the cold. An ice pack, or even a bag of frozen peas wrapped in a thin towel, is your best friend. Apply it to the most painful area of your knee for about 15 to 20 minutes. The cold works by constricting blood vessels, which helps to numb the area, reduce inflammation, and dull the pain signals being sent to your brain. It's an incredible tool for calming an angry, irritated joint. Never apply ice directly to the skin. Always use a protective barrier. On the other hand, when your knee feels stiff and achy, but not necessarily swollen, that's when you turn to heat. A warm compress, a heating pad set on low, or even a warm bath can work wonders. The heat helps to relax tight muscles and stimulate blood flow to the area. This increased circulation brings more oxygen and nutrients to the joint, which promotes healing and eases that deep chronic ache. You can alternate between the two: use heat before a gentle exercise to warm up the joint, and use cold afterward to calm any potential inflammation. It's a dynamic duo for knee comfort. This next chapter is about a topic that can be sensitive, but it is honestly one of the most impactful changes you can make for the long-term health of your knees. We need to talk about weight. I want you to think about this in simple terms of physics. For every extra pound of body weight you carry, your knees feel the force of an additional 4 to 6 pounds of pressure with every single step you take. Imagine carrying a 10-pound bag of groceries. That's an extra 40 to 60 pounds of stress on your knee joints, step after step, day after day. This constant excessive pressure wears down the cartilage, the natural cushion in your joint, leading to inflammation, pain, and the progression of conditions like osteoarthritis. Keeping your weight in a healthy range is not about vanity. It is honestly one of the most powerful preventative and therapeutic things you can do for your body. It directly reduces the daily stress on your knees, which can not only alleviate existing pain, but also help prevent future damage. It is a fundamental key to unlocking a more mobile, pain-free life. Now I know that losing weight, especially as we get older, can feel like a daunting task. But I want you to focus on small, sustainable changes, not drastic diets. It starts in the kitchen. Think about adding more whole foods to your plate. More vegetables, fruits, and lean proteins. Try swapping sugary drinks for water. Even a modest weight loss of 5 to 10% of your body weight can cut your knee pain in half. It's about making healthier choices one meal at a time. This, combined with the gentle exercise we talked about, creates a powerful synergy that lightens the load on your joints and helps you feel better from the inside out. Let's talk about the foundation of your entire body, your feet. What you put on your feet has a direct and significant impact all the way up your kinetic chain, affecting your ankles, your shins, and you guessed it, your knees. Every time your foot strikes the ground, a shockwave of force travels up your leg. If your shoes aren't doing their job to absorb that shock, your knee joints are forced to take the hit. Wearing flimsy, unsupportive shoes is like walking on concrete barefoot all day. It puts an incredible amount of unnecessary strain on your knees. This is why it is absolutely critical to wear shoes with good cushioning and robust support. When you're looking for a new pair of shoes, don't just look at the style. Turn them over, press on the sole, feel the inside. You're looking for a shoe that has a thick, cushioned sole to act as a shock absorber. You also want good arch support to help maintain proper foot alignment, which prevents your foot from rolling inward and putting rotational stress on your knee. A firm heel counter, the part that cups the back of your heel, is also vital for stability. Think of your shoes as a piece of medical equipment, an investment in your comfort and mobility. Don't be afraid to go to a specialty shoe store where trained staff can help you find the perfect fit for your specific foot type and needs. For many people, adding an over-the-counter or custom orthotic insert can provide an even greater level of support and pain relief. Getting rid of those old, worn-out flats or slippers and switching to a properly supportive shoe can be a game changer, minimizing knee strain with every single step you take throughout the day. This final piece of advice is arguably the most important one I can give you. While all the strategies we've discussed today are powerful and effective, they are not a substitute for professional medical guidance. Your body is unique, and the cause of your knee pain is specific to you. That is why you must always talk to your healthcare provider before starting any new treatments or exercise regimens, especially if you have persistent, severe, or worsening pain. Your doctor is your most important partner on this health journey. Think of your doctor as the lead investigator in your case. They can perform a thorough examination, order diagnostic imaging like an X-ray or MRI if needed, and give you an accurate diagnosis. Is your pain from osteoarthritis, a meniscus tear, bursitis, or something else entirely? Knowing the precise cause is the first step to creating the most effective treatment plan. A self-diagnosis can lead you down the wrong path, potentially delaying proper treatment, or even making the problem worse. Your healthcare provider can help you tailor these strategies to your specific condition. They can recommend the exact exercises that are safest and most beneficial for you, advise you on the appropriate use of medications or supplements, and discuss other treatment options like physical therapy, injections, or, in some cases, surgery. They are your guide and your safety net. Please make that appointment. Open a dialogue with your doctor. Working together, you can create a comprehensive, personalized plan to manage your knee pain and get you back to living the life you deserve. We've covered a lot of ground today, from gentle exercises and temperature therapy to the importance of weight management, supportive footwear, and professional medical advice. I want you to see these not as a list of chores, but as a toolkit. A collection of powerful instruments you can use to build a better, more comfortable future for yourself. The power to feel better is truly in your hands. But as you begin to implement these changes, I have to remind you, always listen to your body. It is the most intelligent guide you have. If something hurts, stop. If you feel tired, rest. And always consult your doctor before trying new routines. Your health is a journey, not a destination. There will be good days, and there may be challenging days. The key is to be patient and compassionate with yourself. Celebrate the small victories. The walk that was a little longer, the morning that was a little less stiff. Each positive step you take builds momentum and creates lasting change. Don't get discouraged. You have the knowledge and the tools to make a real difference in how you feel every single day. I want to leave you with this thought. Your knees have carried you through a lifetime of experiences. Now it's time to give them the care and attention they deserve. I encourage you to stay active and take care of your knees for a healthier, happier life. Thank you so much for joining me today. I believe in you, and I look forward to seeing you again right here on the channel. Take care.